Hi, everyone. Dan Eisner here from ZLC Employee Benefit Solutions. My passion is to work hard to find better ways for employee benefits. And I do this by partnering with finance and HR leaders on the market and by leveraging my relatively unique profile. I've got more than 20 years of experience as an employee benefits advisor, but I also have the skills as the only chartered professional accountant working in this industry in the local market. And it's this passion that drove me to develop the Better Benefits podcast series. And thanks for joining me today for another episode of this podcast. Today, I'd like to continue my focus on Ozempic and its impact on employee benefits plans. So it's been about 4 months since my initial podcast on Ozempic, and I have some updates, but I also have a call to action for everyone. As always, I'm going to give you my thoughts, and I'm really interested to know what you think. Also, if you like what you hear and want to learn more, be sure to hit the like button or follow me on my LinkedIn business page to be notified about other podcasts that come. Okay, let's get started. So back in May 2023, I wrote an article about the brand name Ozempic. Obviously, it was titled What's Up With Ozempic? That article and the subsequent podcasts were unbelievably popular. It could be said that they went viral in the context of employee benefits. Since then, many things have changed around this groundbreaking drug. So I wanted to provide an update. But as I said, I also want to provide a call to action for all the various stakeholders involved. But let's get started with some updates. So the interest in Ozempic continues, and this attention is supported by strong advertising campaigns and ongoing media and social media coverage. While the broader class of these semaglutide drugs is expanding, so stay tuned for drugs like Rybelsus and Monjuro, there have also been other weight loss drugs already on the market, things like Saxenda. The reference to Ozempic, though, as the preferred weight loss drug seems to be universal right now. Public interest in using prescription drugs to help with weight loss continues to grow, even though these drugs may have been developed primarily for the treatment of diabetes. So, obesity and related health risks are the issues that many Canadians are struggling with. Healthcare practitioners and the general public can agree that there is a direct link between obesity and other health risks, including but not limited to diabetes, but also blood pressure, cholesterol, stroke, chronic pain, some cancers, and even anxiety and depression. Obesity rates in Canada are already high and have continued to increase. According to Stats Canada in 2018, but that's the most current data, reliable data that's available. But in 2018, 26.8% of Canadians aged 18 and over were classified as obese, and another 36.3% were classified as overweight, bringing the total population in Canada with increased health risks due to excess weight to 63%. As you can see, the broader risk to society related to obesity is significant, but that also means the opportunity related to weight loss drugs is also significant. So the cost of these drugs is high, but not as high as in the US. And unfortunately, the overwhelming amount of media coverage around Ozempic is often biased to the US. And there's references to annual drug costs of $7,000 to $15,000 US for this class of drugs. However, the estimated cost in Canada is much less. It's closer to $2,500 to $3,000 per year. Now, while this is still a significant cost, any comparison to the potential health benefits available is easier to understand and compare to this lower level of cost. The supply of Ozempic doesn't appear to be a problem for Canadians, at least not yet. So much of the Canadian media coverage has been referencing supply chain issues for Ozempic and the broader class of these drugs. However, this has been, up until recently, a more significant issue in the US. Canada has done a much better job at managing this, but there have been some recent challenges given the increasing awareness and supply demand issue for these drugs. As well, it's really interesting to note that as this class of drugs is expected to become available in a pill form, these pressures may subside given the much less complicated process of manufacturing pill-based drugs versus injectable drugs. Okay. There's also been a lot of references to a related drug, Wegovy, and that's been confusing for many Canadians. So again, for clarification, Ozempic was developed to treat diabetes and not weight loss. However, in treating diabetes, they saw the benefits of weight loss for some people and subsequently developed Wegovy specifically for weight loss. Healthcare professionals have confirmed that these drugs are essentially the same. However, it's really interesting that in Canada, Ozempic has been approved for diabetes, but Wegovy has not been approved for distribution, at least not yet. Okay. There's also an increasing number of people who have been taking Ozempic even though they're not diabetic. So, in order to try and take advantage of the weight loss effects, many Canadians who are not diabetics have been taking Ozempic. Because of this, some insurers in Canada who were originally approving these types of prescriptions call that white label use of the drug, but many of them saw significant increases in the use of Ozempic, and they started developing stricter guidelines around approving Ozempic prescriptions. And we should see a lot of these guidelines rolling out in the fall. And even for diabetics, they may be required to start with lower cost therapies before being approved for Ozempic. So these protocols will likely roll out, as I said, in the fall, and they're going to help reduce the utilization of Ozempic within employee benefit plans and likely help mitigate some of the supply chain issues. So there is an update on Ozempic and the broader class of these drugs, but things change and they're likely going to continue to change for this class of drugs and likely going to get even more complicated going forward. At the same time, a lot of the outcomes have not changed, and their potential benefits of proven weight loss drugs are quite significant. So, as I noted earlier, in addition to providing an update since my initial Ozempic podcast, I also wanted to provide a call to action for all of the various stakeholders involved. So, number one, if you're an employee benefit plan member, okay, so for individuals who are part of a plan, particularly those that are obese or face health issues requiring weight loss, you need to speak up and let your employer know that you would like this category of drug covered, along with other existing weight loss drugs. And remember, this could be quite important for them to hear, particularly when viewed through the very topical lens of diversity, equity, and inclusion. I believe covering weight loss drugs should help large number of employees meet their individual personal needs. Okay. Next call of action is for the employee benefits plan sponsors. So I want you to hear from your employees, but even if you do not hear from them around weight loss drugs, you really should be evaluating the long-term savings that might be available from a healthier employee population. Intuitively, there's going to be a positive return on investment in terms of higher employee productivity and lower utilization of other drugs, things like blood pressure, cholesterol, antidepressants, but also lower utilization of other health services, things like paramedical services, medical supplies, and devices. Okay, next call out is to the Canadian insurance companies. We really need you guys to start treating obesity as a chronic disease and include this category of prescription drugs in your standard drug formularies. We need you to start evaluating your own return on investment from this category of drugs. As I said, intuitively it makes sense, but there's been limited research on this topic. And where there is a long-term positive return on investment, employee benefit plan sponsors need to know. And lastly, to alleviate concerns around the proper use of this category of drugs, we need Canadian insurers to be developing clinical criteria, pre-authorization protocols, step therapy guidelines for their safe and effective use. And this work should ideally be done by coordinating with doctors and monitoring plan member progress and health outcomes. Okay, we know you guys have already done this and developed similar guidelines and pre-authorization protocols, which have been used effectively for many other drugs. Okay, my last call out here is to the governments. At both the provincial and federal level, we need government to be looking at the long-term cost savings related to direct medical treatments in the broader healthcare system. Surely there would be a reduction in utilization of doctor and hospital services if obese Canadians achieved weight loss goals and more positive health outcomes. As well, there's also going to be further benefits related to reductions in the strain on families and the involvement of caregivers. Also perhaps weight loss drugs could be used instead of other expensive interventions like bariatric surgery. Look, I'm not a medical expert, but I'm suggesting that this is something worth investigating by all levels of government. So right now, Canadians are less healthy than they've ever been, and an increasing proportion of Canadians are overweight, obese, or even morbidly obese. And this situation is not likely to change anytime soon. So I believe there are significant opportunities available with Ozempic and the broader category of similar drugs that can help Canadians achieve weight loss. Change needs to happen now, and everyone needs to understand the role that they can play in making positive changes. Okay, now you've heard my thoughts and opinions. Let me know what you think. Was this advice helpful? How does this compare to what you're hearing from your current advisor or other advisors in the market? As well, I'm really interested to know if there are any other topics that you'd like to see me cover in future podcasts. Let me know what's bothering you or keeping you awake at night with respect to your employee benefits plans. Thanks for joining me today. Be sure to follow me on my LinkedIn business page, which is Dan Eisner, Employee Benefits Advisor. As well, you can also subscribe to my YouTube channel or get notifications on the next Better Benefits podcast. All that information will come up on the screen in a second. Thanks so much.